Welcome to the Surgical Assistant Podcast, a podcast crafted by surgical assistants for surgical assistants, where professionalism meets passion. Join us in fostering a strong, supportive community where unity among surgical assistants is celebrated and encouraged. Tune in to the Surgical Assistant and level up your practice.
Welcome, everybody.
Hey, John. How are you doing
Kelly.
today?
How are you? I'm John. Welcome to the Surgical Assistant Podcast.
Yeah, but I'm Kelly. Yes, welcome everyone
Kelly.
to
Thank you for
another
that.
episode.
Yes, this is episode 4 of our podcast, and it's about the history of modern surgery, basically. I think it's an auspicious month because the month we're recording this in, and the day that I want to release our podcast is October 16th. It was actually the day that the first surgery was performed with ether. And I think it's what led to the safety and proliferation of surgery as it is today. But we'll get to that further along in the episode. But I figured we should start and talk a little bit about the history of it. And surgery goes back all the way to Neolithic times. And they found the skeleton of a child in Borneo from 31,000 years ago that had actually had an amputated lower leg. And apparently the child had lived 6 to 9 years after that amputation. So they were performing surgery out of necessity as far back as prehistoric times. So I think it's very interesting. So
Yeah, it's fascinating. And I was excited when you told me you wanted to do an episode on surgical history because just the little tidbits that I got in school and some of my schooling is just fascinating how far we've come. And I'm already excited just with your intro of the significance of October 16th. I'm excited that I'm going to go to work on October 16th because I'm working
mhm.
right
Yeah,
around the corner from when we're just in a few days from now when we're recording this. I'm gonna get to quiz people and say, "Do you know what the significance of today?"
yeah. I think it's
Made me
Wednesday.
wonder, and it kinda quiz people and give somebody a little nugget of surgical history there. So that's interesting, John. Thanks for that, for reminding us of
Oh,
the
no problem.
significance of
I've
that.
started doing this every place I am, and on October 16th at the morning meeting, I bring it up, which is a stretch
Oh,
for
that's a
me.
good idea.
Yeah, it's stretched
Uh-huh.
because I'm basically an introvert. I know, but I'm doing a
Yeah.
podcast, but just you and I talking, basically.
Right.
We've known each other for
Right.
years. But yeah, I think our history goes back as far as recorded time. I mean, when they looked in some of the
Mhm.
graves, prehistoric man, they found needles that they used for most likely suturing of wounds, and they had found skulls as far back as 65,000 BCE along the Dnieper River in Russia that had trephination holes in their head. And I think back in 60,
AKA
was
burr
it
holes for anybody that doesn't know that word. I've
exactly
just
trephination
recently
holes? Yep.
read that word. I'd never heard that word, trepanation or trephination. I think there are different spellings and pronunciations for it, John.
Yeah,
But,
trephination is
yeah, that's
one.
so
I always
so
pronounce it
interesting,
trephination,
yeah.
whether that's right or not. And let me correct
Mhm.
myself. It was 12,000 years. 12,000 BCE was when they found the skulls along the Dnieper River that had those trephination holes. And 6500 BCE, they found a whole group of skulls. I think there were 40 skulls, and I think 20 or 30 of the skulls had trephination holes. And they surmised that they were used to treat different medical conditions, maybe seizures from epilepsy. It might have some religious reasons, increased
Mhm.
intracranial pressure. Not that they knew about it then, but they didn't know what else to
Right.
do. So sometimes they would fill the hole with a coin. They would hammer out a coin and fill that hole and then close the scalp over it. They use, like I said, they had found needles and they would use animal sinew. So there weren't that many procedures that they did back then, but they would do a few of them. One of them they would do was the trepanation, like we talked about. They would do bloodletting.
Mhm.
They would do bone setting. They had found the
Mhm.
Aztecs were good at bone setting. They had found quite a few Aztec skeletons that had healed fractures in their bones. And the only way to
Mhm.
get that is to have them immobilized. You can't,
Yeah.
yeah. So they would have them
So we know
immobilized.
archaeologists have made these findings, so there's definite evidence that there was, these procedures or
Mhm.
going on
Yep, they would use animal
so long
sinew to do
ago. I
that.
mean
Yep, they could use
mm.
animal sinew to sew them up. In fact, the Aztecs, if they tried to set it and it wasn't long enough, they would actually make an incision and stick a little shaft of fur from the fir tree. They would get a stick and they would shape it and they would stick it in the intermedullary canal and try to pull it out to length and make it long, the right length again as the other limb that way. I don't know how well that worked. Obviously, I'm sure they died from infection later, but
I mean, it's crazy, and all I can think of in just having this discussion of this part of things is the quote, necessity is the mother of invention. So even all the in caveman times and
Mhm.
prehistoric times, they had needs. They had medical needs. They had injuries,
Right.
and it's just interesting. They had to figure out. They had to had to come up with something to
Exactly. I
fix
love
people and fix the problems.
Yeah, definitely. And of course, war was another thing that led to a lot of great inventions or
Mhm.
discoveries. And some of them were inventions, but most of them were discoveries. But
Yeah.
I find this topic fascinating because a lot of people, myself included, take surgery for no. Back in
Yeah.
2005, I got sick during Thanksgiving, and it was my appendix. Oh, went in, had my appendix out, no problem. But, if you think about it, back then, prior to, the modern era, you died from appendicitis. People died all the time from appendicitis. People died
Mhm.
from the slightest of wounds. I mean, they got nicked, they developed gangrene, and they died. I mean, that was it. There was no saving those people.
Yeah.
You know,
Yeah.
there were some surgeries that were performed, like I said, they did the trepanation, they did the bloodletting, they did amputations. The funny thing about
I wonder
bloodletting
why they would do
is
bloodletting. What was the most common thing
well,
they would
bloodletting
wanna
back
drain
then, they
somebody's blood
believed,
for? Would that
and I don't know who promulgated it, but the belief was that there were 4 humors in the body that existed in balance, and when they got out of balance was when
Mhm.
you got sick, and they believed that you have and I can't remember off the top of my head
Okay.
what they were, but some of them was like green bile, yellow bile. They were named different things, and they thought maybe you had an overabundance
Uh-huh.
of yellow bile, so they would open up a vein and bleed a certain amount, and then stop the bleeding, and then that was supposed to put you back into balance again. Um, and
Wow.
yeah, so that's how it started. In fact, that's what killed George Washington, our first president. He was sick. Supposedly, they think now, as they look at the historical record, he had epiglottitis, which could be fatal in its own right, but he probably would have survived it
Right.
back then with supportive care. But his doctor prescribed bloodletting, and they actually bled him down to 40% of his normal blood volume. At one point, they couldn't feel his pulse, and yeah, unfortunately, he
Well,
expired.
no.
So his doctor killed him basically, and I didn't know that until I started doing research for
I
that, which I
yeah.
find exciting. Um,
Yeah,
but
that's crazy.
the only other thing that they did, like you said, they did out of necessity, which was C-sections, and I think you have a little bit of
Mhm.
information on that, don't you?
Yeah, I was doing just a little bit of research, and C-sections, it's crazy how they came about. I think even prior to I mean, back in 1020 AD is when they say that the first recorded C-sections were performed.
Wow.
Now, the information I didn't get is were they performed on live women,
Mhm.
okay? Because in the Roman religious practice, they could not bury a pregnant woman, so that was against their religion. So my guess is that they were doing these C-sections and performing C-sections to remove the fetus from the body of the
Mhm.
woman that needed to be buried, and obviously the fetus would not be alive either.
Yep.
So they were doing these, and there's evidence of C-sections that go way, way, way back, But the first documented C-section where both the mom and the baby survived, and this is really interesting, was in 1500 by a man named Jacob Neuffer, and he did it on his wife.
Wow,
It was his
really?
wife. Yes,
Oh, man.
and so that was in Switzerland. So he delivered his own child but both mom and baby survived. So that was 1500,
Wow, no
in the
pressure
year
there.
1500. So that's crazy. And then later after, I suppose that by then, yes, they were delivering. Who knows? She was laboring and the baby would
Mhm,
not be born vaginally. He knew that the baby wasn't gonna come out, or whatever the
mhm.
situation was. But obviously later C-sections are performed just to save the life of the child,
Right.
and that they became much more common in the 19th century, of course, with the advent of anesthesia.
Yes.
So and a lot of mothers did not make it through that surgery because of blood loss, I
Mhm.
assume, but also the pain was just, I'm sure, horrific going through that. So I think that's why that differentiated that they would do it to save the life of the child, because back then the mom was probably like, "Okay, she's not gonna make it. Let's save the life of the baby." Is what I'm
Right.
thinking how that kind of doing C-sections came about. But anyway, it to this day, a C-section is the most common surgery in the
Is it
United
really?
States.
Okay.
The most common surgery performed, yeah, with over 1,000,000, I think, a year.
Wow. That's amazing. I just did 3 the
Mhm,
other
yep.
day, actually. It was great.
Yeah.
Um, But I know too they did C-sections to save the baby too because or excuse me, save the mother
Mhm.
in times because let's
Uh-huh.
say the baby was in a breech position and they tried
Right.
turning it and they couldn't. So then at this point they're like, "If we don't do anything, both people are gonna die. So
Right.
let's try and save the
Yeah.
mother or try and save the
Yeah, I feel like
baby."
it was mhm, and I feel like a lot of times it was one or the other, like, "We gotta
Yeah.
save one of them, so let's try to save one of them." But we see that when you know about that that's a pretty straightforward surgery.
You
Do
don't
you
plan on
agree? Like,
sewing them
with
up
the
afterwards. I mean, it's
even
pretty
I
easy.
try to think I try to think about it, back then,
Mhm.
um, and I guess they were doing that would be that's that's a good, food for thought to do some more research on that. I think they were doing
Yeah.
primarily those vertical incisions then too.
Oh,
They
yeah,
weren't
that's
doing a
yeah.
fan and still.
They didn't know
So,
about it. Yeah.
they were doing those yeah, they didn't know about the fan and still, and so, yeah, that's all interesting. We could go down a big rabbit hole with that, just figuring out surgical approaches and whatnot, so that
Yes.
might be a
Yeah.
different episode.
Sure. I mean, yeah, and the more research I did with this, sorry, I just kicked my table here. But the more research I did with
Mhm.
this, the more it just led I had to pare it down because it was just going off in so many different directions. When it would talk about one
Mhm.
surgeon and then you just see all the things he did after that. It this could have gone for 4 hours, this podcast, if we really wanted to include a
Yeah.
lot of information. But I think the main barriers to surgery. There were 3 main barriers to surgery that really had to be overcome for surgery to advance.
Mhm.
And one of them was pain, the other was
Right.
blood loss, and the third one was infection. So,
Okay.
prior to the 1800s when anesthesia was invented, people only went to have surgery when the pain was so excruciating that there was no way they could deal with it. They had to do something because
Mhm.
it was just too unbearable to live with. One of those was
Mhm.
gangrene and have an amputation. The other one was a C-section, like you mentioned. And then the third one was bladder stones. It was called cutting for
Mhm.
stones. And apparently, it was more common in antiquity than it is today. Thank God. Anybody who's had a kidney stone knows what I'm talking about. But these were bladder stones, and
Right.
we don't see them as much now. But they were twice as common in men as in women back then, and they got to be so excruciatingly painful that the patient would actually submit to that operation. Um, and they had 2 procedures for that. One was called the high method, where they went through the bladder. Basically, they made a vertical incision in the abdomen, went down through the bladder, took the stones out, sewed them up. Many of the patients died from bleeding, but some did survive. And then the other was called the low method, where they went right through the perineum or the taint and went after the stones that
Uh-huh.
way, which I would think would be a lot worse for the patient. I'm not sure many of those people survived.
Yeah.
In fact,
Right.
if you're a history buff and you like TV shows, there was a show on HBO called Deadwood, and there was an episode called I don't remember, but it had the word "gleet" in the title, and, one of the main characters, the protagonist, Al Swearingen, who was a saloon owner, had really bad stones, and they blocked off his urethra, and he couldn't pee, and through the episode, he's getting sicker and sicker and sicker, and he almost becomes unresponsive, and the Doc Cochran, who was a doc in the Civil War, has had it
Mhm.
had enough of death, he can't take it, he's an alcoholic, he just drinks to deal with his demons. um they finally get out communicating and he says, "Listen, we have to do something about this." They've been trying to pass the stones with sitting an obturator up his penis to get him to come out, but they wouldn't. So he's like, "I have to operate on you, otherwise you're gonna die either way." So we have the high method and the low method. Which do you want? He indicates the high method. So they prepare to do the
Yeah.
surgery, but then at the last minute, Al rallies, he stands up, they try to get the gleats out, and then they start coming out one after the other, and what I found surprising about that scene was the sheer fortitude of Al to stand up and as a last ditch effort, force all these things out because I think he knew he was gonna die if he
Mhm.
didn't. But how
Yeah.
relieved Doc Cochran was. He actually grabbed him and said, "Thank you, Al. I didn't wanna kill another person." Because that's what surgery was
Yeah.
like prior to anesthesia, prior to conquering infection and blood losses. You died. Very few people survived these procedures,
Right.
especially before they knew about infection. Or didn't happen until after the advent of anesthesia. They kinda all happened right around the same time. So the time from, the
Mhm.
early 1800s to the late 1800s was like the golden period of surgery. This is when a lot of these discoveries took place. Um,
Yeah.
when 1846 was the year when they first used anesthesia in surgery. It was discovered in 1844 by Morton and Long, who were dentists, and they discovered it by huffing it after dinner. I mean, it was the thing to do. They got their wives together at a dinner party, and after they ate, they would huff ether and pass out and laugh about it, thought it was funny. But then they realized, hey, maybe we could use this for surgery because prior to that, they tried laudanum. They tried dosing these people with laudanum, but yeah, they would get them basically to the point they'd pass out. But the instant the knife cut them, they would wake up and start screaming and fighting. And they tried
And opium.
alcohol,
Opium was
opium.
used
Yep.
back then, yeah, opium
There
and when
was
you
even
say
a,
alcohol, do you mean like whiskey
yep,
or
whiskey. Exactly. Yep.
drinking alcohol?
In fact,
Yeah.
Liston, Robert Liston, who we'll talk about in a minute, used to prescribe cordials to his patients during surgery. He would say, "Give that patient a
Mhm.
cordial if he looked like he was becoming too sensible and,
That was
really
the
experiencing
versed of
pain."
that day, right?
Exactly. Yep. And patients had dealt with. Well, hang on a second. Where did I leave off? So I lost my train of thought there for a second. I was going down.
And we talked about earlier, I know we're talking
Oh yeah.
about anesthesia coming about, but we talked earlier about how a lot of the people performing surgery weren't physicians.
That's right, yeah. Initially, they
They were
were
not
clergy,
physicians.
they were clerics, because if you think about it, it was the monks that were passing down the information, right? It was the monks that were copying these texts. So
Okay.
they learned about, these different ways of healing, and a lot of them were holy people, clerics, and whatever lineage of religion. But the Catholic Church came out with an edict, and I'm not exactly sure of the year, where physicians, who were the clerics, weren't allowed to get blood on their hands or do anything to cause somebody to bleed, basically. And,
Mhm.
that was my train of thought I was going down. There was a picture from
Okay.
the 1600s of a guy with a boxing glove, and some of these barber surgeons who they became barbers. The task was passed down to them because the clergy couldn't get their hands bloody. So a lot of times the doctor, clergyman would be there and would attend the surgery and would talk the barber
Mhm.
surgeon through it. And it probably fell to the barber profession because those guys were having to keep their knives sharp, their razors sharp, and their scissors sharp.
Yeah.
So it just seemed like, well, I'm going to get a haircut or a beard trim. You mind taking a cyst off of my neck too? So it's probably
Right.
how it. I'm not. That's speculation on my part, but they had a guy with a boxing glove that would try to knock these people out for surgery because they had to be, to the point where they would try anything just to get out of that pain, and a lot of them
Mhm.
died. The amount of surgery we do on a daily basis in this country dwarfs what they did back then. I think in prior to anesthesia in the Royal Infirmary in Scotland, in Edinburgh, they did, I think, a total of 120 amputations in 1 year, which was not much for a big-sized city as
Right.
Edinburgh was, especially during the Industrial
Right.
Revolution. But there were a few things that were going on at that time in Glasgow and in London, and one of them was Robert Liston. I had known a little bit about Liston in the past, but the more I've read about him while doing research for this podcast, the more I admire this guy. And people went to surgeons back then during Liston's time because they were the fastest. They're like, I got to have surgery. There's no
Mhm.
anesthesia. Let's just get it done and over with quickly. And Liston had a
Right.
reputation of being the fastest knife in the West End. That was his claim to fame, or his moniker, actually. And yeah, he was a showman too. He
What
would come
time
out.
frame was that?
This is right in the
Do you know what that
1800s,
time frame?
so it was, about
Okay.
1824. I think he was appointed the
Okay.
head or at least a consulting surgeon in 1824 to the Royal
So
Infirmary.
1820s, yeah.
Yeah. Oh, and
Okay.
he was in his mid-20s at this, but he had studied, and he was one of the best anatomists. In fact, some of our listeners may know about James Syme, who was another physician. He was actually a cousin to Liston, and they opened an anatomy school together, but eventually they had a
Hmm.
break, and Liston left and went to London. But James Syme was, in fact, there's still a Syme amputation. I think it's through the ankle joint, which we don't do anymore, but he came up with that
Oh,
amputation.
really?
Yeah.
Huh.
And I have a little story about James Syme. He and James Lister, the guy, the father of Antisepsis, were on basically they were attending a hospital in the middle of the night, and this patient is brought through in extremis. The guy cannot breathe because he's got a huge abscess, a fungating abscess in his neck, and it's choked off his airway. So
Mhm.
Syme grabs the knife, makes an incision, and sucks out 3 mouthfuls of pus. He put his mouth on this guy's neck incision and sucked out 3 mouthfuls of pus. Saved the guy's life. I relieved the pressure on his airway. He came back, finished the operation, shelled all the rest of the stuff out, and the guy survived. This was still prior to anesthetic. He had done all that without anesthetic,
Mm.
but there was no suction machines back then, no suction apparatuses, no drains for things like that. This guy just put his mouth on it, and I can't even
Mm.
imagine that. I
That's
almost tossed my
commitment
cookies
there.
when I read it, but he was pretty amazing. But yeah, he and Liston had a break. Liston left and started his own anatomy school. But what made Liston great too was his unwavering knowledge of anatomy. His knowledge of anatomy was what made him the best surgeon. He didn't have much to say about his colleagues. He thought most of them were hacks, and they probably were because they had no idea of about German or infections or, prior to this time, surgeons wore frock coats when they operated. They used their bare hands. There was no such thing as gloves. They didn't even wash their hands. They washed their hands after the surgery. They would come into the operating theater, which a lot of these was in Glasgow or London. So they were called theaters because
Mhm.
that's what they were. They had chairs. They were for students, but they were also open to the public, wealthy people who wanted to observe surgery, who wanted to see these people scream and writhe around. I guess you can show up and watch this.
Mm.
And a lot of times it was standing room only, but the surgeon would come in, put on this frock coat, which was stained with like blood and pus of however many surgeries he did. In fact, the more dirty the frock coat, the more senior the surgeon, right? But Liston revolutionized that. He used a clean frock coat for every surgery. He washed his hands before and
Mm.
afterwards. And when he wrote his book, he wrote 2 books about surgery and surgical technique back in the 1830s. He stressed that you have to clean the instruments in between patients, and you have to clean and get the crust off the sponge in between patients and wring them out. You can't
Mhm.
keep using them from patient to patient because they didn't know, they used them from
Mhm.
patient to patient. So people didn't
Right.
want to go to hospitals back then because they were known as houses of death, and they pretty much were. Once an infection got started in the hospital, somebody got a postoperative infection, like what we would call necrotizing fasciitis today, or what they called erysipelas back then. They would burn the hospital down because there was just no getting rid of it. And people would come in, they would be admitted for one thing, and they would end up getting erysipelas, and they'd be dead in 2 days. So they would just burn the
Mhm.
hospital down. In fact, even becoming a doctor was a dangerous profession. If you cut yourself while you were dissecting a patient, you developed gangrene and died. That was it. I think it was 1 in
Yeah,
4
that's a good point.
students to become doctors died because of that. And I
Huh.
think this is some research I wanna do in the future, but I think this is right around the time of Jack the Ripper, and I think maybe Jack the Ripper
Mhm.
was a student that either left or got thrown out of school because what he did to his victims is what they did to corpses to,
Ah.
dissect them. That's how they learned back
Mhm.
then. They had a corpse and they dissected it in class, but it wasn't easy to get a corpse, A lot of these guys paid nefarious people to bring them corpses, and they didn't ask too many questions.
Oh.
Some of them went flat out went and robbed a grave of a recently deceased person. They would watch the paper, and then they would show up once everybody left and dig the body up. But they had to be careful to not take anything but the body. If they took a ring or a piece of clothing, they had to even leave the coffin because if they got caught stealing the body, they would be convicted of grand larceny if they took anything other than the body. If they took property like a ring or a piece of clothing, and they would hang them for it. So if they got caught
Yeah.
just stealing the body, they would pay a fine. But
At that time, that tells me that was not then a formal studying cadavers was not a formal education. It wasn't a
it was
formal
part of their education, and it
way.
was formal, just, acquiring the cadavers was nefarious. There was
Oh,
no
for
like, today, people
okay, so if
donate
you
Yeah, people donate their bodies to science. In fact, I'm involved with a program, that use what's called plumbed or perfused cadavers to teach the military, and those people donate their bodies to science, and then it's very
right.
respectful. It's done in an ethical manner, but we can recreate wounds on these patients, but they are cadavers
Mhm.
that have, when
Mhm.
they died, their last wish was to donate their body to science, but there was no apparatus like this back then. They had to do
So
with
it
what
was
they
just more
can.
tricky to have the it was more tricky back then to have, I guess, legitimate or upstanding ways to obtain bodies to study,
Yes, exactly. In fact,
I
there was a
guess.
gentleman. This is another reason why I love Liston. Liston was he was not your average European either. He was 6'2". He had huge hands. He was strong. He was a brick shithouse of a man, honestly. He was
Mhm,
strong. In
mhm.
fact, it was said that when he did an amputation, he can hold and compress the artery with one hand and operate with his other hand. But before he went to London, he had heard about, another guy who started an anatomy school, Dr. Knox, who was
Mhm.
terrible. He was awful as a professor, he was awful as a teacher. In fact, he was the guy that prevented Darwin from becoming a physician because Darwin attended his anatomy classes and was just the guy was so terrible, he just left medicine altogether, and he became the
Oh, wow.
anthropologist we know today. Exactly, but there were 2 at this time, there were 2, pair of murderers operating at that time. One of them was hung. I think their name was Burke, and Hand was hung. Burke was able to escape, I believe. I may have it mixed up, but one of their murder victims, a woman named Mary Patterson, whom Liston had known because Liston, when he was blacklisted from the Royal Infirmary, he couldn't operate at the hospital anymore. So he would just go to these patients' houses and operate on them. And that was the
Mhm.
great thing about Liston. His compassion was what set him apart. If you couldn't pay, he didn't
Right.
care. He would operate on you because it was the right thing to do. In fact, he treated a lot of patients that his colleagues had turned away because they felt that they couldn't help him. "There's nothing I could do for you. You're gonna die, or it's too difficult of an operation." One patient had a 40-pound scrotal tumor and had seen several surgeons at the time, and nobody would touch it because, "Dude, you're gonna bleed out if we do that." I don't yeah, and basically, it was ignorance. They didn't really know what they were doing,
Right.
and they knew that if they attempted it, they would die because they just didn't have the knowledge of anatomy that Liston had, and Liston agreed to do it. Unfortunately, he did remove the 40-pound scrotal tumor. In fact, this guy, it was so big, he had to carry it around in a wheelbarrow. I know, South Park jokes
Well, I
aside.
was gonna say, I mean, you think of 40-pound
Yep.
scrotal tumor, I mean, you think about some of the huge scrotal hernias that we see,
Yes. Yep.
that
But they
we've
have their
seen.
whole
That's what
intementum in
I'm
there, yeah.
likening it to. That's what I'm likening it to in my mind as far as size goes. 40
Mhm.
pounds?
40
I mean,
pounds,
that
yep.
is huge.
Yeah.
Mhm.
But, Liston told him, he goes, "I'll do the best I can for you." So he was able to remove the entire tumor. Unfortunately,
Wow.
he had to take the testicles as well, because if he didn't, the guy would have bled out because there was a lot of vasculature in
Mhm.
there. And the gentleman also lost 2
Right.
inches of his penis, but he survived, and that was a case nobody else would touch. So,
Wow.
I think that's where being raised with a family of clergy lent to a lot of his compassion, and I think fed into his arrogance with his peers because, you know, I compared to him, their peers were he was a giant in the field of surgery. Not only was he a giant of a man, he was also a giant because his knowledge of anatomy was better than anybody else, and it was said that his dexterity was the best in surgical history then or today. Well, I don't know
Wow.
how they'll know about today, but they said at the time that his knowledge of anatomy in his hands, his dexterity. I mean, he was so fast when he did an operation.
Yeah.
I mean, when you think about it,
Skilled. He just was skilled, yeah.
he was skilled. He has the fastest mid-thigh amputation on record, which was 28 seconds. So you got to figure these patients, there's no anesthesia. It takes 2 to 3 people to hold these patients down.
Oh my
So you wanted
gosh.
somebody that was fast. And initially, he was around
Yeah.
2.5 minutes for an amputation, skin to skin, but he got that down to 28 seconds for the actual amputation part. And
Mm-mm-mm.
the thing about Liston was he was always trying to get faster because he knew speed was the key. They bled less, the less
Mhm.
time handling these tissues, the less chance of
Right?
infection, the less pain these people have to deal with. But he was also a showman too. So he would show up into the operating theater, put on a clean frock coat, and then hold up his knife, the knife he invented, which that's another reason I love Liston. When I do amputations to this day, most every hospital has the Liston amputation knife. He designed that knife
This is
because
that long,
that long, yep,
straight,
it's 11 inches, 12 inches, it's got like a
sharp.
10-inch
Mhm.
blade, super sharp. The
So
original
sharp.
one
Uh-huh.
he invented was double-edged because he wanted to be able to cut in either direction, but prior to that, the technique for amputations was guillotine amputation, just straight, round, that's it, cut it off, leave a stump, that's all they did. But Liston came up with the idea of making like a fish mouth incision where you left 2 flaps to cover the bone, and it would
Uh-huh.
leave it more useful for the patient, number one, because they could support weight with it. They'd have something protecting that bone. So he came up with bone nippers to actually nip off the bone so they could cut it back. But he would turn the flaps
Yeah.
back with his hand. But he invented the bulldog clamp, which I did not know. Bulldogs that we use commonly in vascular surgery because he wanted these quick things to
Mhm.
attach to the bleeders and then he would tie them off later on. But the patient would come into the operating room, they would be on the table, 3 to 4 people to hold him down. Liston would come in, put on his frock coat, holding his knife, and he would say, "Time me, gentlemen, time me." And then he would make an incision. He would turn the flaps back with his hand. He would take his Liston amputation knife, insert it horizontally along the top of the femur,
Yeah.
turn the blade up,
Yeah.
make a fish mouth cut up, put the blade under the femur, turn it down, make a fish mouth cut down,
Okay.
take that knife, put it in his
Mhm.
teeth because he's holding the other hand,
Oh my
compressing the artery
goodness.
with his left hand, put the
Mhm.
bloody knife in his teeth, take the saw, 6 strokes of the saw at least, cut the bone would come off, and then they would deal with the bleeders, tie those off, and then he would close the incision over it, and then he would dress the wound with cold water and linens, which some of the other people were not doing, most of the people weren't doing, because prior to this time, treating amputations, you treated them with boiling oil afterwards. Ambrose Paré, that's the way he did it, that's the way he was taught to do it, but that led to a lot of
How are they
increased
cutting through the
mortality and
bone, John? I'm sorry to interrupt you. Was that a
what's
more
that?
like a
No.
giggly type saw?
Nope, it was, looked like a carpenter
It
saw,
was like a
kind of.
like a carpenter saw,
Yep, it was
okay.
a handsaw, yep.
I didn't know.
Cushing later on used the Gigli saw to get into the
Okay.
skull. He learned that in Europe,
I
but,
wasn't sure about the timeline on that, yeah, okay, huh,
yep, and I'll insert a
interesting.
picture of,
So just
if
like
I
a
can find it.
carpenter's
Yeah, it looks like a little yeah, you've most people have seen them. In fact, they're still in hospitals today. We don't use it much because we usually use a power saw, but we always have those
mhm,
backups in case there's no power. But
mhm.
the
Huh,
yeah, it looked like a tiny little saw. So I'll put a picture up here of an old time amputation set that had several different knives, scalpel, all different things,
okay,
spools of linen for tying off the arteries and stuff. But he would
yeah,
turn the flaps back and then boom, he would close it up and the patient would leave. And most of them at the time, he had the best success rate in Edinburgh. About 1 out of every 10 amputations, the patient died. And with his colleagues, it was 1 to 2 out of every 4 patients died from an amputation in the hands of his
wow,
other
that's a
colleagues. But
huge difference,
yeah,
wow,
he was so fast. He's known for several things. One of them is the only surgeon in history to have a 300% mortality rate in a single surgery. And you're thinking 300%, how could that be possible? Well, he did the surgery fast as usual. He cut his assistant's hand. He nicked his assistant's hand. The patient bled out. His assistant died of gangrene when he nicked the hand. But being that this was an operating theater in England, people were standing pretty much shoulder to shoulder with him while he's operating. And when he passed the knife to his assistant, he cut the coat of a man standing next to him, and the guy had a heart attack and died right there. So the patient died, the assistant later died of gangrene, and then the other guy dropped dead at that time from being so scared of being cut with the
oh
knife.
my
He wasn't physically
goodness,
cut, it was just his jacket that was cut, but yeah,
right,
scared him so much he dropped dead right there. Now there's no written history of it, it's an oral tradition passed down, it's probably not true. It was probably made up by his detractors at the time, but there's a lot of
uh-huh,
interesting things about Liston, excuse me, and I keep screwing up those 2 names because 'cause they're so close together, but his patients did a lot better because he had his assistants change their dressings every 10 minutes. So they were like linen soaked in cold water, and that was probably another reason they didn't get infected because that didn't sit on there for weeks at a time unchanged and allow the bacteria to fester. So,
right,
um, he was a pretty amazing man,
wow,
but when it comes to Robert Knox, that surgeon that he had an issue with, the anatomist, he had heard that he was going to dissect the body of Mary Patterson, who was also doing charitable work in the slums at the time, and that's how Liston had known her. And Knox had made a public announcement about it that he was going to dissect her body publicly because it was also something that people showed up to see as well. You can buy a ticket to that and see it. But it just offended Liston so that on the day of the dissection, he shows up and in front of everybody, all the students, all the spectators, he just knocked this guy Knox just flat out knocked him out on the ground, unconscious, took her body and gave it a proper burial. Yeah. But
oh
back
wow,
in this time in Victorian England, people would hire people to sit over the graves of their loved ones because they didn't want the bodies robbed to use for anatomy.
ah,
There were all kinds of booby trap devices invented to prevent people from stealing the bodies. There were grates and locks and stuff that were placed over the graves to keep people from getting access to it, to stealing it. So it was a very weird time. But that was pretty much pre-modern,
mhm,
just before modern surgery. So modern surgery could be said to have been started with the first surgery with ether. And that was my impetus for this, podcast, and when I wanna release our series on October 16th, because
mhm,
that was the day that the first surgery was performed with ether, and it was performed at, Mass General Hospital in Massachusetts by Dr. John Warren, who was a famous surgeon at his time, but he's now pretty famous for doing a relatively simple operation. But a gentleman named Gilbert Abbott was having a cyst removed on his neck. He was 17 years old, and he had heard about Dr. John Warren had heard about ether from James Morton, um, and had told him, "I think this might help surgical patients." So he said, "Let's try it. We'll try it on Gilbert Abbott." So Gilbert
mhm,
Abbott comes to have this cyst removed. It's a theater to a certain extent, so there's people there. Morton had made this like crude glass sphere that he had put a linen soaked in ether inside it and had Gilbert Abbott just breathe it for a little bit and he goes unconscious and he turns to John Warren and says, "Doctor, your patient is ready." So picks up his
Huh.
knife, dissects out this cyst, no problem. Everybody looks at this guy. Is he alive or is he dead? In a few minutes, he stirs. Everybody goes nuts. It's unbelievable. Warren turns around and he goes, "Gentlemen, this is no humbug." I always thought that was great. These guys have become very poetic from that. But so Liston hears about it in England. He reads about it in the Lancet and he had heard about it from somebody else. So he decides he's going to do an operation with anesthesia. That was done a couple of months later in December. It was December 21st, 1846, I believe. And it was done on a gentleman named William Churchill, who had a bad infection in his leg and needed his leg amputated. And they bring
Mhm.
Churchill in. He's sobbing. I don't know if I can go through with this. This is terrible. And Liston reassures him, does his usual showmanship. He had made an apparatus for this guy to breathe ether. So and this is why I love this, because it's just the way the showmanship of him, but the poetry in his words. So he comes in as usual. He puts on his clean frock coat, holds up his knife, and he says, "Gentlemen, in this room, you have seen me try to assuage the pain of the knife." He said, "I've used hypnotism, I've used mesmerism, we've tried alcohol, we've tried laudanum, but today we're going to try a Yankee Dodge and see if that works. So time me, gentlemen, time me." So he does it, does his thing. Nobody has to hold the patient because he's not struggling. Takes the patient's leg off in 25 seconds, bandages it up. Patient eventually stirs. And this is what I love about it. Churchill wakes up and he's like, "Forget it. I can't do it. I can't go through with it. Take me back. I'll die as I am. I don't want to go through with it." Liston lifts up his bloody stump, holds up his other amputated leg, and the guy just bursts into tears, and they carry him out. And then the crowd goes wild. And he just turns around to everybody, he says, "Gentlemen, this Yankee Dodge beats mesmerism hollow." And that ushers in the modern era of surgery. But
Yeah, and
it also ushers in what's called the dark period of surgery as well. But is there anything you'd like to add? I know I've been rambling for a while.
no, I mean, all that is so fantastic, and I just think about the evolution of all of those components, to doing a
Mhm.
successful surgery, and you hit on the 3 major ones, blood loss, infection, and I mean, I say you hit on them, but that was literally the evolution of surgery. We had to figure out how to overcome these 3 major obstacles, which were anesthesia, blood loss, and infection
Mhm.
for the safety and survival of patients that were having surgeries, and just to see how far we've come. Even when you think about anesthesia and how rudimentary it was back then, and they obviously were doing the best that they can in the circumstances they were in, and they were looking at and developing, but I think of ether and how and I thought also the interesting part of how
Mhm.
ether was discovered, that it was being used recreationally. Uh,
It was, yep.
it was being used recreationally by
Mhm.
the was it the gentleman that kind of said, "Hey, try this?"
Morton and Long, they would both do that. In
Mhm.
fact,
Yeah.
Simpson, another contemporary, found a chloroform. He would
Mhm.
huff. He wanted to find out. Okay, so he learned about ether, so now he's just started huffing these other things at home after dinner with his wife to find something else, and they
I
found
mean,
chloroform, and it actually worked
mhm.
better than ether because ether was really caustic to the lungs, it caused a lot of
Okay.
secretions, and if you needed to
Okay, see, that's
reoperate on a
interesting, yeah.
person, you couldn't do it within a certain amount of time if they had ether because it would just be too much of an insult to their lungs.
Okay,
Um,
mhm.
and he found chloroform, which was much gentler on people. Unfortunately, more people died with the use of chloroform than they did with ether.
Mhm.
And as a matter of fact, if I remember correctly, he used chloroform to deliver a baby from a woman. It was the first delivery where they used an anesthetic and he used chloroform.
Mhm.
And the rumor is that she named the baby Anesthesia. But I did some digging. That's not true. The baby's name, I forget what it was, but they nicknamed her Anesthesia.
Oh, funny.
The mom
That's
nicknamed her
funny.
Anesthesia, yeah. But the thing what I love about Liston was he was an innovator. He made sure that his instruments were clean. He wore a clean frock coat. He washed
Yeah.
his hands. He invented the knives that he used. He invented the bulldog clamp.
Mhm.
He cared about his patients. If they didn't feel right, if they had a sense of impending doom, "I don't think I should do this surgery right
Mhm.
now," he would put it off. He would put it off. But at the same time
Uh-huh.
at the same time, prior to anesthesia he had a patient that needed a bladder stone removed, and the guy chickened out at the last minute, jumped off the operating table and ran into a closet and locked himself in a closet. And the 6'2" Liston runs over to the closet, rips the door off the hinges, and grabs the patient and
Oh my
drags him back to
goodness.
the operating table and operates on him. I never found out what happened to
He
that
said
patient,
you
but
that's funny.
he was more compassionate, and so that was 1846. Now, 1846 to 1870, about 1865, was considered the black period of surgery because now they had the
Okay.
means, like Liston had said in his speech, to render men insensible, which but, so now they were doing more operations because they didn't have to worry about people screaming, but now they still
Uh-huh.
didn't they haven't conquered infection and they haven't conquered bleeding, so
Right.
excuse me, they were doing pretty significant operations and patients died. But it wasn't until James Lister, the father of antisepsis, basically, when he had heard about the sewage works in Carlisle. A friend of his was a chemist. They were at the University of Edinburgh together, and a friend of his had told him, "Hey, in Carlisle, they're using carbolic to treat the sewage works because the stench was so bad, the citizens couldn't deal with it. So they would put carbolic in the sewers, and it would kill the smell." And Lister,
Mm.
being a physician and a student, he was a student physician at the time, he knew that the smell of the operating theater and the wards in the hospital and the dissecting rooms and the sewers smelled exactly the same. So he's, "I wonder if I
Mhm.
can use that in surgery to prevent people from getting infected," and he tried it, and sure enough, it worked. So
Huh.
he invented a pump, and he would operate in a mist of carbolic acid. Somebody would stand there with a pump the whole time and pump it into the because he believed that the germs were in the air as well. So this is around right about the time the germ theory was discovered with Robert Koch and those other people. Semmelweis had known about it because he had done some studying of pregnant women who got puerperal fever after having kids, and he found that, wait a minute,
Mhm.
doctors who delivered babies had a much higher incidence of puerperal fever than the midwives. Why is that? It's because the midwives washed their hands before they delivered a baby and put on clean clothes. Doctors didn't. They wore the same dirty frock coat,
Yeah.
didn't wash their hands. Why would you? You got all these nasty chores to do. Why wash your hands first? You want to wash them afterwards. It was only humans. They didn't know any about that stuff. So that's how this came to be developed. Lister, excuse me, had a patient with a fractured femur, excuse me, fractured tibia and open fracture, compound fracture. And normally it was an 11-year-old boy named James Greenlees. And normally the prescription for this was amputation because gangrene would have set in, osteomyelitis, the kid would have died, amputate the leg as quick as
Right.
possible. Now they had ether, so it's not such a painful procedure. You feel a lot less guilty about doing it on a patient when they're anesthetized instead of a poor child that's screaming. But in fact, Liston had done an amputation on a child, and he had gotten the kid fairly well relaxed. In fact, he had sat with the child and he had told him, "Hey, listen, this isn't gonna hurt any worse than having a tooth out." Okay. Does the amputation on the kid. The guy was interviewed 60 years later, and he still remembers it took 6 strokes of the saw to take his leg off, and that's 60 years later after they pumped this kid full of morphine and alcohol,
Wow.
and Liston told him it wasn't gonna hurt. He still remembered how many saw strokes it took, so but he
Yeah.
could have done that easily, taking this kid off with very little pain, saved his life. Boom. But he decided to
Mhm.
treat the kid with dressing soaked in phenol, which is, I think it's derived from coal tar, but it's basically a light antiseptic in the concentrations he used it in. So he reduced the fracture, trimmed away the dead material, what didn't, what the skin and tissue that didn't look like it was going to survive. He trimmed it away. And then he treated it by putting these phenol soaked dressings on it. In fact, I don't know if we still do, but we used to use phenol in the operating room when people did a matrixectomy, when people would have an ingrown toenail removed. You would
Uh-huh.
slice down the part of the toenail that grows, and then you would take a Q-tip dipped in phenol and put that in there. That would kill the matrix in the nail bed, and it wouldn't produce a nail anymore. And then you would neutralize it with alcohol. So,
Okay.
I don't think we still do that anymore. There might be better techniques, but that was recently up until the 90s. I remember doing that in the 90s.
Huh.
There's still some things that are holdover today, and that's why I just love the fact that almost in every hospital, they
Right.
have a Liston amputation knife. It's fantastic, but
Yeah.
was that as a
Yeah.
direct link between us and Lister,
It
and he
really is.
adopted
Yeah, it's
anesthesia.
cool.
Unfortunately, he only lived another year. He passed away in 1847, but he was one of the guys that helped usher in this era. He revolutionized amputation, saved hundreds of patients when if they'd have gone to his colleagues, they would have died. But,
Mhm.
So
I have a
Liston.
fun fact about the Liston knife. Can I give it to
Oh,
you?
yeah,
This is
please.
just this is a really fun fact. In 2013, when I got out of FA school, and I've mentioned this in other podcasts, I went to work with a vascular
Mhm,
surgeon who I ended up getting along with really well. Country boy from Alabama, grew up
mhm,
in Alabama, country boy, hunting, fishing, that kind of thing. Fantastic vascular surgeon.
okay.
Unbelievable. And I was doing, amputations with him, and he was showing
Mhm,
me he pointed out that knife one time during a case, one of the first amputations that I ever did, and he's the first physician that I ever did an amputation with.
mhm,
So he was showing me that knife, and he's, "Man, I love this knife. It look at it, it's just so sleek, it's so
mhm.
sharp, it's gonna cut right." He's like, "Well, it's gonna cut through this muscle and skin like butter. It's gonna cut through this tissue," and he just raved about this knife. And he was right. We did the amputation, and I was like, "Holy cow, I've never seen a knife that sharp," Yeah, it's doing what it's supposed to do, right? Well, time ticked by, and I kept working with him, and his birthday was coming up, and I worked in the office with him and so I was real close with the office staff, and I went to surgery with him, and so I really started thinking about what I could get him for his birthday, and I
Mhm.
thought, "It would be awesome if I could get one of those knives. Could I even do
Oh my
that? Could
god,
I get a
really?
knife?" John, I contacted the person at the hospital that purchased instruments.
Okay.
Do you I was able to buy one. I was
Wow.
able to buy a knife.
Mhm.
I don't know, how, and this was in, like, probably 2014
Okay.
or 2015. Maybe I think it was 2014. It was $60 is all it was.
That's it? Really? Wow.
Mhm.
I bet
Yep,
you it was
it was
razor
60
sharp when
bucks,
you
and
got it too.
I was so ecstatic when she told me that I could buy it.
Mhm,
They ordered it, I gave her a credit. I don't really know how that
mhm.
worked on the back end, but I was able to get him that knife and completely surprise him for his birthday. I have pictures of him opening
Oh,
that
cool.
knife and seeing it. It was fantastic. So,
Oh, I
anyway,
bet
that's a
you he
little
woulda loved it.
fun fact. He
I bet
loved
you
it.
he loved
Yeah, it
it.
was
That's
great.
great. I
Mhm.
have another little fun fact about the Liston amputation knife too. That was the preferred knife of Jack the Ripper.
Was it really?
Yep. He liked to use the Liston
Ew.
amputation knife to do that. And I really think
Oh,
I know there's been a
no.
lot of speculation on who Jack the Ripper was or wasn't, but I think he was a medical student, had either left or was kicked out. Anyways, we
Huh,
didn't go into the history of serial
could have
killers in
been.
this episode, but
Yeah, no.
so Stir decided that he didn't say anything after James Green leaves. He decided to wait and collect a series of patients, right? So he collected a series of 11 open fractures that he treated with this new phenol technique. And out of the 11 patients, one died from blood loss. One ended up
Okay.
getting gangrene and had to have their limb amputated anyways. But nine people walked out of the hospital with their limb intact and no infection, which was unheard of at the time. That was
Those good stats, yeah.
unbelievable. I mean,
Mhm.
you were guaranteed to die if you had an open fracture. And that was it,
Mm,
if you didn't have an amputation,
right.
which was during the Civil War, the same thing. The reason why they treated those nasty gunshot wounds is they didn't have a way to treat the infection. See,
Huh,
they didn't have a way to treat the infection. If they didn't take
right.
the leg off, the patients were going to die. And so here's another fun fact. Do you know the percentage of amputations done during the Civil War that they used anesthesia for? So the percentage of amputations that had anesthesia,
I do not.
97%. 97% of the
Really, that
amputations
high?
performed in the Civil War had anesthesia. So they misrepresent it in all these movies where they just give these people a stick to bite on and take their leg off. It's not what happened. There's a
Interesting.
great book. There's a great book called The Medical and Surgical History of the War of the Rebellion, 1861 to 1864. It's a great book, or 1865.
Okay.
Anyways, and there's also a National Civil War Medical Museum in Frederick, Maryland. I saw a great lecture by James Wonderluck, who was the director of that, or George Wonderluck, excuse me, was the director of that. I don't know if he still is, but
Yeah.
they have a great little museum there. It's small, but it's pretty powerful. But yeah, in fact, in that book, they say one of the surgeons talked about it. He said, while we had a severe lack of supplies, our greatest lack was that of ether. So we had to put off surgeries to the next day that would have best been done today. So, um,
Wow.
and a lot of times, I mean,
Okay.
people say bite the bullet. They used to give a soldier a bullet to bite on, but that never made any sense to me. Think about it. You give
Right.
somebody a bullet
Right.
to bite on, you cut their leg, what's the first thing they're gonna do? They're gonna scream, right? So they're gonna open their
Mhm.
mouth, they're gonna take a big breath, and you're gonna aspirate that thing. A stick is
Ri
more believable, right? The bullet
right, that
came
is
from the bullet
true.
they used in the Civil War, and the way they did it was packed with the mini ball and all that, but this is in the Civil
Right.
War lecture. But, so yeah, so
Okay.
Liston found that this is working great, so he started operating in this mist of carbolic, and, it was working great. The infection rate was dropping tremendously, and, um, so then William Halsted heard about it. Everybody in our professions pretty much knows who Halsted is because we've heard of Halsted's
Right.
tissue handling techniques and all of it. Halsted was another pioneer in surgery, and he had adopted Lister's techniques. These Liston and Lister things are screwing me up because the
I
names are so
know.
close
It's
together. And they were at
confusing.
the same time, they were at the same school together too. That's what really
Just call
screws
them
me up
Ton
when I
and
read
Tur.
about it. Right, exactly.
I'm gonna nickname them Ton and Tur.
Oh, I like that. That's good. But yeah, so he would pump this mist in, and then Halsted saw it and he started adopting the same techniques, and he would operate in a mist of carbolic. His scrub nurse, Caroline Hampton, she had a terrible allergy to the carbolic. So her hands would turn red and they would
Mm,
break out. In fact, she threatened to just
mhm.
abandon her post. She's, I can't deal with this anymore. I'm leaving. So Halsted writes to the Goodyear Rubber Company and asks them to create a pair of rubber gloves for her. So
Huh.
Goodyear does. They create rubber gloves. Her hands are protected. She's able to go on and operate with them and continue to operate. And in fact, they were married a year later, Halsted and Hampton.
Huh.
That was a little romance that was saved by rubber gloves.
Interesting.
But so antisepsis started to really progress after this. And then
Yeah.
Robert Koch, who is a microbiologist, basically starts comparing different things. He's looking at microbacteria. He starts, excuse me, taking swabs of doctors and surgeons' hands and growing them in test tubes. He takes swabs of infected wounds and grows them in test tubes. And he learned and he saw that, hey, wait a minute, these bacteria are the same. The ones that are killing these people and the ones that are on the doctor's hands, they're the same thing. He also found harmless ones too, but there were many harmful ones. So we started experimenting with different ways to kill them. And he found out that boiling did a much better job. That's when this carbolic acid started to phase out because boiling was much better and the steam autoclave had come into play.
Mhm.
So, once they were able to do that with the steam autoclave, and then now more surgeons were adopting gloves and
Mhm.
masks and different clothing, things really started to change right around this time. This is, I think, right around 1930, that era. I think,
Okay.
let me think. I know that, let's see, Halsted and Hampton were married in 1890. So just after this, the turn of the century, 1900, things start to change. And then you have World War I comes around. And that's when
Right.
they learn that sodium citrate would keep blood from clotting. So now they're able to bank blood, which they weren't able to do before. I mean, they had tried
Mhm.
blood transfusion, so now we get to the third barrier, right? Infection is
Right.
pretty much being dealt with now with antisepsis and all that, and
Mm.
anesthesia with ether, so now we've got blood loss
Right.
to deal with. They had been trying
Mhm.
transfusions. I think the first transfusion was done in England in 1677, I believe. I forget the hospital,
Mhm.
1677. It didn't work because a lot of the early transfusions were done from animal to man, and that's
Right.
not gonna work, and they were done with
Right.
lambs. They used lambs a lot because one of the belief was that some of the character of the donor would pass to the recipient, and lambs were docile, so we could,
Mhm.
little those, but it was an utter failure, and it was abandoned completely after a French surgeon was sued by a patient's family from a patient who had died. So,
Mhm.
but then with the advent of and they had tried people-to-people transfusions or patient-to-patient transfusions, and with
Mhm.
disastrous results. They didn't know anything about blood typing or anything, so some people
Right.
did fine. I mean, some
Right.
people were able to just take it. They were the right by chance, they were the right blood type,
By
and they
chance.
survived, but they didn't know how much blood they got either, so they just watched it
Right.
pass from they just had to guess. But then when the advent in the early 1900s and 30s of tissue typing, then they were able to figure
Yeah.
out, okay, now we bank these blood, it's broken down into groups and positive and negatives and all this. They were able to streamline the blood.
I'm gonna interrupt you for a
Please
second. So
do.
blood transfusions would be after the fact that they lost a lot of blood. So go back to intraoperatively, how were
Mhm.
they stopping bleeding? Did they figure I mean, they already knew, obviously, that you pinched off a vessel and it stopped bleeding. And
Right. Yeah, they had
so were
clamps
there
and
any,
ligatures.
yeah, were there any advanced, so it was the clamping and
Mhm.
suit, like
Yep.
just ligature, I
Well, they had
guess,
known
of,
about
or
ligatures goes all the way
ligating,
back
sorry.
to Ambrose
Mhm.
Paré. He was the one that figured out to use sinew or twine to tie off arteries.
To
And Liston had known that. Liston had used those bulldog clamps as a temporary means of hemostasis, and then they would go back and tie everything. They
mhm.
would use sinew or
Yeah,
catgut, which is just, bovine sinew basically,
right.
and,
But yet and still these
or
patients were
cotton
losing a
linen.
lot of blood.
Yep, they were. But they
Yeah.
were Liston was always refining techniques, so he was quicker and they didn't bleed as much. But the bleeding really wasn't conquered until they were able to do transfusions. And 1818 was
Mhm.
when they did the first human blood donor, but that was disastrous. And then 1900, Carl
Mhm.
Landsteiner discovered blood typing. And then World
Yeah.
War II hits 19, what was that, 1915, 14 to 17, I think was World War One. Excuse me. World War One
Mhm.
hits, then they find out that you
Around,
can use
yeah.
sodium citrate to keep blood from clotting. And they were
Okay.
able to keep
Yeah.
blood for a couple of days and give it to patients. Now they could type patients and do that. But then in Russia, Stalin's Russia, they started doing cadaver to human blood transfusions because in a cadaver, the blood doesn't clot. So you have a couple of days, you keep the body cold, that keeps the blood from being exposed to air and it doesn't clot. And then you can transfuse it to a patient or take it and give it to a patient. Now, that has huge ethical implications and it was eventually abandoned in Russia as well. But after World War One, World War Two rolls around, and by 1930, they had pretty much had gotten blood donation and banking down. So people just out of their own kindness of their heart, they weren't paid for it, they would go donate blood. So now surgeons
Right.
had reserves of blood to give to patient type specific
Right,
blood to give
okay.
to patients. It
Yeah.
was pretty really started taking off from there. And then with Halsted and
Right.
Cushing, these people were just making, leaps and bounds
Mhm.
in the advancement. Cushing would operate he only did one type of operation, and that was tumor removal, a brain tumor removal, but he was the only person, pretty
Mhm.
much operating on the brain, and his operations would take a while, but they had an incredible success rate. He was losing, I think I don't even remember. I don't even wanna speculate because I don't remember the number offhand, but it dropped
Right.
I think it dropped down from 70 patients out of 100 to 1 out of 100. So,
Wow.
he improved his technique. He was always refining his techniques,
Mhm.
and he would use a ton of hemostats. If you ever see I'll try if I can find it, I'll insert it into this podcast.
Yeah.
Students were so enamored of him that they recorded his 2000th surgery, which was a hypophysectomy, basically the removal of a pituitary tumor. They
Okay.
recorded it and you can see in this thing, he's probably got 40 clamps on the scalp and everything, and he gets 5 or
Oh
6
my
or
gosh.
about 10 of them together, and then he ties them in a bundle and then clips that linen bundle to the drape, so it's not a patient's tissue isn't
Ah.
supporting it, and then he would use a giggly
Mhm.
saw to gain entry into the skull, and then he would peel back the dura, and he was the
Yeah.
first surgeon to use diathermy.
Crazy.
The first surgeon to use electric artery in surgery was William Cushing.
Uh-huh.
Um,
Yeah, wow,
and
okay.
he really drove, uh, the profession forward. And
Mhm.
then once basically, once we conquered those 3 barriers was when surgery really took off. And,
Yeah.
but heart surgery
Yeah.
really didn't happen until about the 1940s. And, I'm
Yeah.
not gonna go too much into that because that could probably be a whole 'nother podcast, just
Oh, yeah, I
about
mean, we could
surgery
delve off
from
into all the
that.
specialties
Yeah.
from that, yeah.
But I mean, it accelerated at light speed pretty much to look what we can do today. I mean, 160 years ago was when they did that operation with the first anesthesia with ether, with either
Mhm.
Gilbert Abbott and having his cyst removed or William Churchill having his leg taken off. 160 years later, now in Saudi Arabia, we've just done the first robotic liver transplant and the first robotic heart transplant. I mean, that's in a space of 150
It's
years. When like you mentioned 10, what was that year? 1062 or whatever was the first
yeah,
C-section on
yeah,
record.
back in, yes.
So from
Uh-huh.
1062 to 1846, a very little progress was made, because those
Mhm.
barriers weren't able to be conquered. The amount of
Mhm.
surgeries that were done a year were very small and the number of surgeries were very
Yeah.
small. Now
To
in
where a
our
surgeon
country,
can operate remote, you're right.
yeah, now nobody thinks anything of, "Oh, I tore my rotator cuff, I have to have surgery." tore a ligament in my knee. I have to have surgery. I got to have my bunion fixed. I'm going to have this done. I mean, surgery.
Well,
I got a hernia. I have to have it.
they're elective. They're
Right. They're
elective
elective.
cases.
It's
The
just
majority
taken
of
for
cases we do
granted.
are elective.
When 160 years ago, you didn't want to have surgery. You didn't want to go to the hospital because
No.
it was
It
the
was
house of death.
necessity, it was trauma, right, mhm.
In fact,
Yep,
in the 90s, I had a girlfriend. She lived in England, and she was a great girl, but she hated the hospital because it still had that
yeah,
reputation of being the house of death. It was
right.
still in the
Yeah,
collective. It's not true, but British hospitals are some of the best in the world, just,
mhm,
first world hospitals. But I've done surgeries in third world countries and have excellent results. Our patients had
right.
we used modern anesthesia, we used modern techniques. They did wonderful.
Yeah,
But,
yeah,
nowadays, even tragic things like your poor little baby's born with an atrial septal defect, which is a hole
right.
in, the collecting chambers of the hearts, or a ventricular septal defect, a heart in the pumping
Mhm,
chambers, a hole that's between the 2 pumping chambers. We can fix
right.
that, no problem. Kid could live a normal life and go
It's
on, have kids and everything, where, 200 years ago, that would have been a death sentence.
oh, I
Tetralgia
know.
philo,
It's
that bad,
yeah, just
4 deformations in the, vasculature of the heart. That was basically fixed in, was it the '40s by William Blaylock and,
mhm, yep,
Vivian Thomas. Let's not forget about Vivian Thomas, his surgical assistant. Vivian Thomas did all the
mhm,
work in the lab. He dissected all of the dogs. They did this. They recreated it initially on dogs because that's what Blaylock wanted to. He wanted to come up with a cure for the blue baby syndrome. So what they had to do is first recreate it. So it was Vivian Thomas who
uh-huh,
figured out a way to recreate it by, I think he sutured the pulmonary vein. He made it smaller and bypassed the pulmonary
uh-huh,
artery, and he recreated it. So once they recreated it, then they figured out how to fix it. And it was basically Vivian Thomas, who was a black surgical assistant. Basically, his lab assistant figured out the technique. He came up with the instrumentation, and he actually talked to Blaylock through the first several operations to do this, and it revolutionized it. In fact, there's a great movie called
um,
Something the Lord Made with Alan Rickman and Mose Def. Mose Def plays Vivian Thomas, and it's set first he's in Vanderbilt, and then he gets recruited to Johns Hopkins to do the surgery. And
mhm.
Ann Tussig was another physician. She was involved in this. So the technique was called the Blaylock-Tussig technique. But
That's
it
amazing,
Yep.
that's cool.
Yeah, I would recommend a lot of surgical assistants, or if you have an interest in surgery, some of the books I've read to prepare for this was called The Butchering Art by,
Mm,
Lindsay Fitzharris. Great book on the history of surgery and Lister and Liston. She's also written another book called The Facemaker about Giles, who was the father of modern plastic surgery. It came out of World War One. It's called The
mhm,
Facemaker, also by Lindsay Fitzharris. And what was the other book I read? Destiny of the Republic, which is doesn't have anything to do with surgery, but it talks about James Garfield, who was our president in 1888. I believe he was assassinated. He was shot by James Guiteau, who was basically a crazy guy, but he survived the initial shooting. The reason he died
mhm,
was his physician did not believe in Lister's techniques. So he would probe
uh,
the wound with his finger daily. He took great delight in the healthy pus he saw flowing every day. He would prescribe him rich meals and alcohol to drink, and did nothing. If he'd have used Lister's techniques, Garfield would have
yeah,
survived and probably would have been one of our best
right.
presidents ever. But
That's
that's another
interesting,
good book.
yeah,
There's a lot more out there on this subject. So if you're interested in it, I highly encourage you to read Fitzharris's books. They're absolutely fantastic.
yeah, yeah, and I know you've told me about 'em. I plan to get at least The Butchering Art. I really wanna read that one. Well, John, this has
Well
been
worth it.
so fun today,
Oh,
so
yeah.
a fun discussion. It's really cool to learn about the history of where we've been and to be living it's exciting to be living in the times that we are as far as, surgical and surgery and surgical technology go. It is really amazing to see where we are and to know that advances are being made every day. It's a field that continues to evolve in all the areas we've discussed. As
Mhm.
we could bring all of those things forward, how anesthesia has continued to evolve. Just we could
Yes.
have a whole episode in different paralytics that are used, different
Yes.
gases, what's not used anymore, all kinds of
Oh, you
things
mentioned
we could
the
do
that
there.
that brings up something else that in the reading that I've done, that was another thing that ushered in the modern era of surgery because when they were using ether, they'd have to give these patients so much ether, their tissues would be saturated with
Mhm,
it just to get the
mhm.
muscular relaxation.
Right,
It didn't take very much ether to put somebody to sleep and render them insensible for surgery, but if you were doing an abdominal operation, you needed the abdominal muscles
right.
relaxed. It took a ton of ether.
Right.
So it wasn't until
Right.
they observed these South American tribes, and then the pharmaceutical industry created curare, which is a muscle relaxant, that this
Mhm.
was really able to push surgery forward even further. It was a push
Yeah,
forward that it
so that
needed.
yeah, right, so it's just like a snow so those it just perpetuate each obstacle, it just more things were perpetuate, like, we come across another problem, we need to figure out a solution for that, and it just
Mhm.
has gone on down through the ages and the centuries that it's just amazing to where we've come from with blood loss, devices that we have today to control bleeding or to replace volume in patients. I mean,
Cell
just
saver.
the modern day of where we are with all of these things, infection control has come such a long way, and we're still continue to learn things in these areas that we can always make improvements and to keep patients safe. So it's a
Right.
fascinating discussion. I'm so glad you had the idea for this episode. And I'm sure in the future, like I said, we
Mhm.
can extrapolate different areas and go down history rabbit holes, so to speak. So it's going to be interesting to see. Hopefully the listeners you'll let us know if you enjoyed this discussion about history of surgery, and we can certainly do
Yes. Please do, and
more
if I got
topics. I'm
anything
glad
wrong,
you're as
like dates
knowledgeable
or
as you are,
names,
John.
if I got
Yeah.
anything wrong, like
Mhm.
dates or names, please put it in the comments and let us know, because I definitely,
Yes,
wanna
yeah,
be
correct
correct with
us,
that.
yeah,
But I think,
right.
one of the things that, we can learn from Lister, what can we take from James Liston, the fastest knife in the West End as surgical assistants today, and I think his idea and his motto that he lived by is that you have to know the anatomy. You have to
Yes,
absolutely master anatomy if you wanna be a
that's
good surgeon or
mhm,
for us, a good surgical assistant, because if you know where it is, then you
mhm,
know what you'll need to take it out and what could possibly go wrong.
yep.
If you know
I
where the
can't recommend
nerves are.
enough the Netter's Anatomy book.
Yeah, that's a good one.
I
You like
can't
that one?
recommend yeah, I like that one as far as just studying, yeah,
Yeah.
anatomy. That's one of my favorites. So, yeah, John's right. Honestly,
Mhm.
I remember them telling us I know we need to wrap up, but them telling us in school, you don't have to be afraid of being unfamiliar of a case if you know your anatomy.
Right.
If you know your anatomy, that's number 1. Eh, know the procedure, I mean, kinda know the steps of the procedure, but also just be teachable. You can do
Mhm.
any case, but
That's true.
I put at the very priority of that is knowing anatomy, and I it's just something that you can study constantly and still not know 100%, but I enjoy studying anatomy, so, yep, it's a
Yeah. I
good
do the
tip.
same thing. If I'm doing a big case, like a colon resection, I always review the
Mm,
anatomy so I know the wheel, all the different
yep,
arteries and blood vessels and veins that we need to know.
yep,
Um, I always
yep,
make sure I review that because if I think if you know the anatomy, then
yeah,
you'll
it's a big
always know where
deal.
you are, um, and you'll know
Mhm.
what to watch out for too. That's what's important.
Know those
So
landmarks and
exactly.
landmines, that's what I like to say. I know landmarks and landmines, it's important.
Landmarks and landmines. I like that. Yeah. That's a good
Yep.
one. I like that. Um,
All right.
but
Well, it's
let's
been
see if there's anything
fun.
else I wanted to include. I don't think so. Just that I have an absolute love of surgery and that, like I said, when I do an amputation, unfortunately, but when I have to do an amputation and we have that Liston amputation knife, I just feel a direct lineage direct back to him.
Connection,
Back in
yeah.
1846 doing that first one with ether.
Yeah.
And, it's just amazing, and I think it's tradition is what keeps us grounded in this profession, and there's always been that push-pull in medicine between the conservatives and the radicals, and that's why it was so loath to change for so long, but I think that's good. We need that.
Mhm,
People were resistant to take on Lister's techniques
mhm.
and Lister's, methodology, but eventually we did, and that's when we really took off. Listerine is named after
Yeah.
James Lister. I mean,
Yep. Mhm.
and a lot of those instruments that they used, we still use today, which I find fascinating. He
That's
invented a
right.
bone
Yeah,
nipper. I mean,
that's
there's just
fascinating.
tremendous. I
Yep.
could talk about this
Mhm.
for hours because it all
Yep.
feeds
I
in. I mean,
know.
it feeds
It
into so
does,
many other
it
areas. I
does.
could talk about James Garfield and there's other things I could bring up, other surgeries, Queen
Yeah, well,
Victoria,
it's cool how
there's,
some of those tools that were invented so far, so long ago are still relevant today. They're useful, they're
yep,
relevant, we need them, and I'm talking about they used them a long time ago. The knife, for instance. I know it's just a knife, but is it just a knife?
right. It's
It's
yeah,
really cool. It
it's
is
technique
cool.
specific, yes, and then there's the bulldog clamps, you
Yeah.
have the Halsted clamps, we have all if you just
Mhm.
research some of these instruments, they're all named after
Yeah,
somebody
and
for a
how they were
reason. The cryo
mhm.
clamp. I mean,
Fogarty.
there's a
Yeah,
lot I could
I
go into
know.
about cryo, but we won't go into that now.
Yeah,
But yeah,
yeah.
and we can pick it up and talk about history of the modern area of surgery. We can pick it up from heart surgery. I mean, heart.
Oh, for
It was
sure, yeah.
verboten to touch the heart. You
Right.
shouldn't. In fact, Bill Roth. All these youngsters today won't know who Bill Roth is because of proton pump inhibitors.
Mhm,
We don't do Bill Roth 1 or Bill Roth
mhm.
2 gastrectomies today
Anymore.
for ulcers like we used
Right,
to. I remember a lot when I was younger, we did them quite
right,
often, usually on the weekends, but, um, yeah, he said to not touch the heart at all. So, I mean, and
right.
he was a pioneer of his time too. He was huge. He was a giant in
He was,
surgery,
yeah.
and, we can pick it up from there out and then talk about cardiac surgery. We can have a friend of ours on to talk about cardiac surgery. That's what he does. He
Mhm.
always gives great lectures at
Oh,
the
yeah,
ASA conference or the NSAA conference. I got to
yeah.
reach out to him and hopefully we can have him on as a guest. But yeah,
Yeah, alright. Well, we're gonna go
cool.
and leave you guys, and
Yep.
please tune in again.
Thanks for joining
Pick
us.
up another episode. Yep, thank you for listening,
Let us
and
know
we'll
how you
see you
like the
soon.
series. And if you have any comments, leave them, any suggestions, any critiques. And don't forget to like, comment, and subscribe. So thank you. See you on the next
Bye.
one.
Thanks for listening today. We invite you to like and subscribe to this channel and leave a comment if you'd like. Feel free to look us up on Facebook at the Surgical Assistant Podcast or email us at thesurgicalassistantpodcast@gmail.com. Until next time, content of this podcast is in no way intended for diagnosing or treating surgical conditions. No patient-specific information is shared, and all HIPAA guidelines will be adhered to.